Diabetes complications. Okay, you've got to know about diabetes for the NCLEX. If you studied one complication, one pathophysiology, one set of drugs, one thing for the NCLEX, it should be diabetes and the associated care and pharmacology for diabetes. Why? Well, I think I've said before, I have not been to the hospital in a day where I have not taken care of a patient who has diabetes. Pretty much everybody who goes into the hospital has diabetes. You see diabetes in med-surg, you see diabetes in psych, you see diabetes in OB, you see diabetes in peds, you see it in newborns, you see it all over the place. You're always taking care of patients with diabetes no matter where you are in the hospital. And so this is something that you have to know about because every other new grad also knows about diabetes, not just because you see it in the hospital, but everybody knows about it. So you got to know about diabetes. Now, we're going to talk about low blood sugar and we're talking about high blood sugar in patients with diabetes in this lecture. So with low blood sugar, let's talk about the causes. For type 1 and type 2 diabetes, for low blood sugar, the causes, the dangers, the signs and symptoms, and the treatments are pretty much the same. Okay, now when we switch to high blood sugar, we're going to start having different causes, signs, and symptoms of treatments between type 1 and type 2 diabetes. But for low blood sugar, they're the same. Okay, so the causes of low blood sugar are not enough food, essentially carbohydrates, too much insulin, or too much exercise. Right? Those are the three causes of low blood sugar for type 1 and type 2 diabetes. Not enough food, too much insulin, and too much exercise. Now, it's a little more complex than that because it's not just about not having enough food. There's some more complex metabolic pathways that start to get formed when you eat a standard American diet that's pretty high in carbohydrates. The body begins to rely solely on those carbohydrates for fuel. Now, your liver does go through this process called gluconeogenesis. And that's basically the process of your body producing glucose to be used. Because you have to think back, say 10,000 years ago when you were walking around the woods, no matter where you lived in the world, you weren't getting much sugar in your diet. Where was the sugar coming from? Well, occasionally you might find some fruits or berries on the tree or bush, but how long is that fruit ripe on the tree? Right? Just a couple of weeks, maybe a month, and you're competing with all the other animals for that food. So you're not getting a lot of sugar in your diet. That's why our body is able to produce glucose for our brain to use for its metabolic processes. Okay, so causes of low blood sugar: food, not enough food. The second is too much insulin. Third, too much exercise. Now, what are the dangers of having low blood sugar? Well, again, your body can create glucose because your brain requires it. Okay, so brain damage is a potential outcome for a client with low blood sugar. That's why these are always a high priority client. Okay, regardless of how long they've had a low blood sugar, regardless of if it's chronic or not. No, they need to be able to maintain an appropriate glucose level of above 60 to 70. So use 70 as the cutoff for the NCLEX. You want it to be between 70 and 100. Okay, so the danger is brain damage. Always a high priority client. What are the signs and symptoms of low blood sugar? Well, I want you to remember two words. A, I want you to remember the word drunk. And B, I want you to remember the word shock. Okay, so they're going to appear drunk and shocky. All right, so drunk, they're going to have cerebral impairment. Right? They're going to feel lethargic. They're not going to answer questions appropriately. They're going to be kind of comatose. Right? They're going to be appearing as if they're drunk. The second thing is they're going to appear like they're in shock. They're going to have vasomotor collapse. All right, so they're going to appear drunk and shocky. All right. Another thing you can remember is cold and clammy, give them candy. All right. So if they're cold, clammy, drunk looking, shocky looking, this is a patient who most likely has low blood sugar. Right? So what's the treatment for low blood sugar? Well, we're going to administer a rapidly metabolizable sugar or carbohydrate. And ideally, we want a sugar with a starchy carb. So one thing that is really good is skim milk. All right. You got some protein and you have the sugar, but you don't have any fat. So it's rapidly metabolizable. Another thing that's really good is to give some orange juice and turkey. So they got that sugar and they have the protein, and it's going to be metabolized pretty quickly. Now, do you want to be giving turkey to a client who is unconscious? No, right? So if they're unconscious, this client is NPO. Don't be putting stuff in their mouth. It doesn't matter how much stuff you go shove it in there. It's not going to get absorbed. So you're going to be giving either IM glucagon, IV dextrose, presumably D50, all right, depending on how severe it is. So your facility is going to have a protocol for what you do based on different blood glucose levels and your patient's level of consciousness. So if you have a patient who has a blood glucose level of 30, but they're still alert and they can swallow, there's no need to go jabbing them with glucagon. Right, so your protocol may say that you're going to give them some oral glucose, and it might just be orange juice. But if they're alert, that's one thing. Now, if that patient with blood glucose level of 30 is unconscious, you're not going to want to be pouring orange juice down there. Okay, so those are the causes, dangers, signs, and symptoms, and treatments for low blood sugar. All right, so now let's talk about high blood sugar. High blood sugar has different causes between type 1 diabetes and type 2 diabetes. So let's focus on type 1 diabetes for causes, signs, symptoms, and treatment first. Type 1 diabetes is caused by, the high blood sugar is caused by too much food, not enough insulin, not enough exercise. But the number one cause of a high blood sugar in a patient with type 1 diabetes is an acute viral upper respiratory infection that they've had in the past 2 weeks. Right? So, and here's how that works. You have an upper respiratory infection, which causes stress hormones to be released in the body. The stress hormones release glucocorticoids, which leads to some dehydration, which increases the blood sugar and can send the patient into DKA, Diabetic Ketoacidosis. All right. So type 1 diabetes gets caused by too much food, essentially carbs, not enough insulin, not enough exercise, or a recent viral upper respiratory infection. So the signs and symptoms of high blood sugar are, oddly enough, the same as for DKA, right? D standing for dehydration. You're going to have K, which is ketone spillage into the urine. So they're going to have increased ketones in the urine. And you're going to have acidosis, right? DKA. That acidosis, you're going to notice potentially an acetone-like smell on their breath. You have a fruity breath. But primarily the easiest way to tell is those ketones in the urine. Treatment for high blood sugar is you give D5W with regular insulin in a drip. Okay, so A is D5W, B is insulin. It's regular insulin. And the dextrose and the insulin that's being infused is going to grab the glucose in the blood and draw it into the cells. Okay, it's going to, insulin, remember, is a key opening up the body's cells to allow the sugars and also potassium to go in. So those are the causes, signs, and symptoms and treatment of high blood sugar for patients with type 1 diabetes. Now, for type 2 diabetes, the causes of type 2 diabetes, there's basically two general overriding reasons that people have high blood sugar with type 2 diabetes. Either they have a cellular resistance to the insulin, so their cells become insulin resistant, or the second reason is that your body stops producing enough insulin. So the pancreas stops producing enough insulin. And it's not always a case of the pancreas stopping to produce enough insulin. Typically what happens is patients get fatter and fatter, and eventually they reach a point in their obesity that the pancreas is not able to keep up. Right? So a lot of times that's why we tell patients, if you lose some weight, you won't need to necessarily take insulin. They might just be able to take an oral medication to help manage their glucose, because their pancreas is able to keep up and produce enough insulin for the size of their body. But your pancreas never anticipated you becoming obese, so it never anticipated being able to scale up manufacturing of insulin that fast and that high, right? It has limited capacity. So what about the signs and symptoms for high blood sugar and type 2 diabetes? Well, this is essentially the same signs and symptoms as dehydration. So this is going to be a patient who is going to be feeling warm because they're having difficulty maintaining their normal body temperature. They are going to be thirsty. They're going to be peeing a lot. So that's that polyuria, polydipsia. And they're going to be hungry. Well, why would they be hungry if they have all this sugar in their blood? Why would they want to be eating all the time? Okay, so they're going to just be wanting to have sweets. Well, the cells aren't getting the sugar. It's stuck in the blood, right? So the cells don't know that they have access to this sugar that's already in the body. And the cells are starving because the insulin key will not open up the door to let the food, that glucose, into the cells. So the cells are saying, feed me to the brain. And the brain's saying, okay, because it feels like it's producing plenty of insulin from the pancreas, it's producing all it can, but it's not able to keep up. So that's why these patients are going to be hungry, because while they have plenty of fuel in their body and they're adding plenty more, they are not able to access it. The body's cells are not able to access it. So at the same time that the body is overloaded with food, it's also starving at a cellular level. Now, the treatment for type 2 diabetes is you're going to want to rehydrate them. Okay. High blood sugar, they're going to manage it with insulin, with oral medications, with diet, exercise, but ultimately it's rehydration at the acute level. So those are some of the complications for low blood sugar and high blood sugar for patients with type 1 and type 2 diabetes.